Good evening. Uh, my respect to my teachers here, my colleagues, students. It's a great privilege to be with you now. I joined here as a student in 1986. It's almost 37 years. And first 20 years, I have been extremely lucky to be with Dr. V. Other than family members, few of us had this wonderful opportunity. How simple he was and how punctual he was. He was role model. And he lived his life and showed how to live. He was so punctual that punctuality got into our DNA. He was so dedicated, and the dedication also went into our heart. And our beats were beating with his heart. One of these days, I want to tell you what happened is, I was a student, I was pregnant, and 9 months nearing term, and I had high fever. Those days, we didn't know anything about COVID. So even when we have fever, we used to come to the hospital. If you are not able to work, we ask our teachers, leave personally. There is no phone call, or we don't suddenly take leave. I come and I'm not able to walk. I enter into the OPD, and those days OPD is only one hall. New and review is different, but all new patients only one hall. There will be 6 or 7 chairs, and Dr. V will be in one chair, Dr. Nachir madam, and RDR sir, MSR, anybody can come in that room after their theatre. So before theatre, Dr. V will be there. He will be alone. And we students will come and join, and we were students only, but he will sit near his chair. So with the idea to ask leave, I am entering the OPD, but OPD is so crowded, and he is sitting all alone, and I am seeing his white khadar shirt, and there are so many bleeding points, because you all know he had psoriasis, and he always had a comb with him when he has severe itching. So he was scratching it, and the bleeding points were appearing in his shirt. How can you ask leave? How can you leave a person in that age alone with this crowd? No, you forget your fever, you forget everything. You just want to be with him and help him handle the patients. So because he was the role model, when he had diarrhea, I still remember Dr. Kim entered his room and he just started asking, how are you? I am also standing with Dr. Kim. I personally saw the dialogue between both of them. Before he finished, how are you? He started telling something else to Dr. Kim and told him, never ask about my health. Don't remind me that I have diarrhea. Do you have diarrhea? That was the question he asked, because he never showed that he was sick. So we all were trained in that mood always. And regarding punctuality, he was punctual, and we can only be punctual. There is no other way, because he is there. And whole home, our family, even our distant relatives, everybody knows that 8 o'clock or 7:30, before that, 6:45 in theater, on theater days, is the most crucial time, and nobody will disturb me. Whatever happens. I wanted to share one very, very important day in my life. My father-in-law was also an ophthalmologist, Dr. V's very close friend and colleague, student, and he was in his elderly age. After Chief passed away, he was still living, and he was in aspirin tablet. And morning, it was 7:45, I was getting ready. I was very nervous. I wanted to leave immediately. At that time, he fell down. And there was a deep cut here, and there was bleeding. Me, my husband, and my father-in-law, only three at home, because children have already left. I mean, they were studying and they were in hostel. And my husband took a cotton and he was pressing like this. And he knew that father-in-law needs a suture, and we don't have suture or anything there. But still, the only word my husband told us, I will take care of my father, you go to your hospital. Because go to your hospital at right time was the only mantra in our home. How did it happen? It happened because of Chief. It was not forced on us. Nobody asked us. Nobody shouted. Dr. V has never shouted at anybody. In my life, I have never seen him shouting at someone. He was very quiet. And I told you I had fever in that day, and I was not able to work, and I kept my head like this on the table because I was really sick. Chief saw me and he didn't shout, he didn't ask anything. He just gave a compassionate look. I told, I'm sorry, sir. Then I started working again, and there was no dialogue at all. Hospital used to be like ashramam, and only patients will talk and the doctors will answer the patients. It is something very different experience. And I used to think that even if I die, at 8 o'clock, my spirit will enter this hospital. It is because of Dr. V. And those wonderful days, I can never forget. And then we found out the cause for leptospirosis. He was very happy, very happy. Personally congratulated. Such a big man. He need not congratulate me. I am a small nut in this hospital. But he congratulated, he called. He asked me to give the talk, which I gave there, and he personally attended the talk. So those things are jewels in my life, in my memory, in my brain. And when I did 40 cases of extracapsular, those days only extracapsular cataract extraction, no phaco, I thought he will appreciate. I was happily entering room. We enter his room at any time and we can discuss anything. He was so approachable. All our founders are so approachable. I can go and tell that I'm hungry. To that extent, they were basic. They were down to earth. So I went and told Sarah, today is the first day I finished 40 cases. Rathinam, only 40. I thought you will do 100. So Dr. V was a magical man. He made us work. He is really leader, as Dr. Krishnadas told. He laid the path and we just followed. And whatever I entered this hospital like a clay. The hospital molded. Hospital gave life. Hospital gave everything. Then Dr. GS, Mr. GS. Luckily, I know him for 35 years. Again, once upon a time, I was thinking that he's a very tough man. He's not smiling. When we wish, he's not wishing back. But I soon realized, no, he has an extremely soft and kind person inside. But he's not an expressive man. He will not express. Both Chief as well as GS, they were not expressing their feeling out. Only we have to find out what they feel. After a later period, GS became like a child. And he'll be standing always, even in the COVID time, he will stand in the gate. I have asked several of us, all the seniors were very concerned. And we were telling him, you are a diabetic, sir. You, in this COVID time, don't come. Or at least don't stand here. And he will have edema both legs. Sir, pedal edema is there. Don't stand here. At least sit. No, Ratna, I want to stand here. Sir, you build a room in that 5, that waiting place 5, and have a glass door, and you sit and watch everyone. No, no, I want to stand here. I don't want to sit. Like, he was so determined till his last period. And he became like a child. We both were taking steroids. He was taking steroid, I was taking steroid. When I come down, he will give a warm smile. Rathinam, what is your dose today? I'll tell 20 milligrams, sir. I have made it 10 today. No. Once I told I am on 5. Then he was keeping like that. No, I am on 20. So it was a game between us, how much steroid we take. Such a big man, such a big calculations, such a big brain about finance. But we were like children at some point of time. I cannot stop. I have so many things to share with you, young people. But seniors know much better than me, so I should not make it a boring session. Both GS and GV sir in my life, like my parents, play big role. And today I am here because of them. Thank you.